Hi, my name is Dr. Meek, pain management physician for Advanced Bone and Joint. At this point, if you're seeing this video, we may have met each other at this point already. But what I want to talk about today is an epidural steroid injection. This injection is commonly recommended, and we'll talk about it, if I believe it would help you with what we call radicular pain, or what people refer to as sciatica. This is one of the most common conditions that we treat and can be very painful, and obviously we want to try to help you get better. The procedure can be done in one of a few ways. It can be done both the neck or the lower back for pain that goes down any of the four extremities. The approach for the injection is trying to get the medication directly over where the problem and where you're getting compression on the nerve. As we do this, we're doing a couple things. One is the steroid hopefully calms down any inflammation you have in the area. And the second thing is that physically putting the medicine in those locations also helps with breaking up any scar tissue or washing away any of the inflammatory markers that are around the nerve causing the pain. Each time we do the injection, people tend to get better. Some people kind of talk about what's called a series of 3 injections that can be completed, but typically we try to get people by with just maybe 1 or 2 injections and then working with physical therapy along with that. A lot of patients are really hesitant and cautious about what to expect during the procedure, and they're concerned about the risk. What I can tell you is that with my experience and working with patients, we make sure that everyone's very comfortable and they understand exactly what's going on as we're going through it. Most people actually say that going through the procedure is nowhere near what they expected, and that they've been dealing with a lot more pain to that point than what they experienced during the procedure. The biggest risk of the procedure is most commonly just some soreness from the injection site. This lasts about a day or two. The things that really bother people or that they're worried about, such as like bleeding or possibly nerve injury, luckily are very rare and have been reported at 1 in a few 10,000, and typically aren't seen in any medical practice over a career of a physician who does the appropriate care. There is possibly side effects with the steroid medication that we also talk to patients about. If you're diabetic, you may experience some increased blood sugars, and some people get some flushing. Also important to let me know if you're taking any blood thinning medications. This includes medicines like Coumadin, Plavix, Pradaxa, Eliquis, or Lovenox or heparin. These medicines need to be stopped for a safe period of time, but then we can proceed with any procedure. You can continue any anti-inflammatories or aspirin. Overall though, again, this is a very routine procedure. We do everything we can to make sure people are taken well care of and get through this process safely. If you have any questions, you can always contact our office and we can talk it through further, but I want to ensure you're in good hands.